pandemic for countries. In exiting lockdown, and we understand that countries in exiting lockdown are trying to put economies back on track, trying to bring social cohesion and social interaction back, and that's laudable. What we've asked for is a careful, stepwise approach, that each move is measured and the impact of the release of measures is measured in a way that we can see any increase in cases and, if necessary, reapply measures. We've also said that you have to replace lockdown with something else. And we've said consistently, I think, and Dr. Tedros has said this on many occasions, we need to have a strong, empowered community who are educated and participating in the response willingly and are able to sustain a new normal, able to sustain the new behaviours, around physical distancing, hygiene and other things. We have to have a strong public health response, and I would commend South Africa in the way in which it's energised and mobilised its community health workers for both community education and surveillance, the way that the capacity to detect, test and trace cases has increased across South Africa through the use of mobile clinics and mobile teams, and that measured approach allows countries to come out of the so-called lockdowns and replace lockdowns with a more comprehensive set of public health and social interventions that will allow us to live in a more sustainable way with this virus until we reach a point where we have vaccines or other interventions that may eventually allow us to eliminate the virus. That, though, being said, is a difficult challenge for many countries, particularly in the south, where the concepts of social distancing, of hygiene, of surveillance are difficult to achieve, especially when many people live in poverty and in overcrowded and in conditions where those objectives are hard to reach. So we need the external world, other countries need to provide all support possible particularly to countries in Africa, to achieve those goals in terms of being able to support communities, support surveillance, and support the health system to cope. But we believe progress is being made. In Africa in general, we've seen a stabilisation of the situation. However, in some countries, the disease continues to be on the rise, and therefore we have to be very, very careful and ever vigilant over the coming weeks and months.
Yeah, thank you, Sophie, and nice to hear your voice. I just would like to add, of course, Mike had covered, your question, but just to add, first of all, one thing which was very important that Africa did was the meeting in February that helped of the ministers of health that helped develop the continental strategy and aligning national plans and strategies with the continental strategy. And then the other important development was the creation of the coalition of leaders by President Ramaphosa, who is the current African Union chairperson, and also the leadership by the African Union Commission chairperson, Dr. Moussa Faki. And then the other important step was the social distancing in Africa. The measures, social distancing measures, actually started while the number of cases were low. So it was done as early as possible. I think that helped in slowing the epidemic. Now, the issue is Africa is again starting to open up. So when it opens up, the recommendation from WHO is it has to be a phased approach. And South Africa is doing that, and many countries are doing that. It has to be a phased approach. And at the same time, we need to continue to strengthen, especially the case identification, tracing, and other public health measures, and especially the involvement of the community and the involvement mobilizing community health workers to be involved, as Mike said, which is happening in South Africa and other countries, and really strengthening that part and following the developments seriously and strictly. So based on changing situations to take measures, like for instance, some of the measures which are taken in opening up can be reversed if there are challenges. For instance, South Korea did that when it opened up and then started to see some clusters of cases, then started to take action, social distancing, which is tailored to that. So the vigilance and the strict follow-up will be very important. But of course, as Mike said, I understand, and I'm from Africa, how difficult it is to implement some of the social distancing measures. But based on the situation, adapting to the situation, taking the maximum measures you can take will be very, very important. So thank you again, Sophia, and look forward to continue to talking to you.